Welcome back to the Deep Dive, especially for all of you listening who are part of our Asthma Friend community. Well, today's Deep Dive is probably going to hit quite close to home.
Mhm.
With International Nurses Day coming up on May 12th, we thought it was the perfect time to really focus on the role nurses play in asthma care. It's often kind of unseen, isn't it? But so, so vital.
Absolutely. It's like the heartbeat of managing asthma day to day. We often talk doctors, meds,
Right.
but nurses, they're often right there with us. We're drawing today from the Asthma Friend blog, specifically their piece celebrating nurses, unsung heroes in asthma care.
Yeah, a really insightful piece.
It is. And our goal today really is to get into all the different ways nurses support us, sometimes in ways you don't even notice at the time.
hmm
From spotting those first tiny signs to, well, just being a calming presence.
Okay, so let's unpack that a bit. Starting with something you mentioned, spotting symptoms early. The blog highlights how nurses are often, the very first people to notice subtle things.
Exactly. Like a little wheeze maybe you haven't clocked yet,
Yeah.
or a cough that's just sticking around a bit longer, maybe breathing that's just a touch faster than usual.
And they see this where in clinics, schools,
All those places. School nurses, clinic nurses, hospital nurses, sometimes even during a home visit. They're trained to pick up on these, well, seemingly small things that could actually signal trouble ahead.
and that early catch can make a huge difference, presumably. Life-saving even.
Oh, definitely. Think about spotting something early means treatment can start sooner. It can stop a mild flare-up turning into a full-blown serious attack. There's actually data showing that nurse-led monitoring and early intervention can really cut down on hospital readmissions for asthma. So yeah, potentially life-saving.
Wow, okay. And then when attacks do happen, nurses step in very practically, right? The blog talks about emergencies.
Yes. In that moment, if you're struggling to breathe, say at school or you're already in the hospital for something else, who's often right there? The nurse. Getting the nebulizer, go in that machine that turns liquid medicine into a mist you breathe in,
Right, right.
or grabbing your quick relief inhaler, maybe getting you some oxygen. They have those immediate hands-on skills.
It's not just following a checklist either, is it? It's quick thinking.
Precisely. They're assessing you in that specific moment and acting fast based on what you need right then.
It makes you wonder, doesn't it? How many times has that quick action been the thing that turned an emergency around?
Something you probably don't even think about when you're just trying to catch your breath.
Exactly.
But it's not just emergencies. The blog really stresses their role in education, teaching us about asthma.
Yeah, and this is huge. It's way more than just handing you a leaflet.
Okay.
It's about sitting down with you, maybe your family too, and really explaining things. Like showing you exactly how to use your inhaler properly, which so many people struggle with.
Oh, definitely. Technique is key. And explaining why taking your control and medication every day is important, even when you feel fine. Helping you pinpoint your triggers and figure out how to avoid them. That's real empowerment.
Giving you the tools to manage it yourself.
That's it.
And the blog points out this education is maybe extra important for certain groups. Kids, older people.
Yes, absolutely. Think about explaining asthma to a 5-year-old versus an 85-year-old.
Yeah.
Very different approach is needed, right?
Totally different.
Kids might need visuals, games. Older patients might have issues with, say, hand strength for inhalers. And if you're newly diagnosed, you're often overwhelmed. Nurses are usually really skilled at tailoring that education.
Adapting it. Makes sense.
Mm.
So asthma management, as the blog says, it's not just one thing, it's ongoing. Nurses seem key in that continuous loop of care, too. Monitoring follow-up.
Yeah, the continuous oversight is crucial. It's not just about treating attacks, it's about preventing them. So nurses are often the ones checking your oxygen levels regularly, tracking your symptoms over time.
Looking for patterns.
Exactly. Looking for trends. Is it getting slightly worse? Are you needing your reliever inhaler more often? They spot these things, and importantly, they flag it up. They're the ones often saying, okay, maybe it's time for a check-in with the doctor.
Acting as that link in the chain.
A vital link, keeping things controlled long-term.
Now, the blog also specifically mentions the situation in India, saying nurses there have an even kind of amplified role.
That's a really interesting point it makes. Because of things like doctor-patient ratios, especially in maybe more rural areas or government hospitals, nurses often carry a huge amount of the direct patient care load.
So they're bridging a gap.
A really significant gap. They become that essential connection between the patient and the doctor, making sure care continues smoothly. There's some evidence from nurse-led clinics in India showing better patient adherence, better follow-up, precisely because of that dedicated nursing support.
And even in cities, the blog gives examples like Nurses giving daily nebulizer treatments, maybe at home or in a clinic.
Right. Or tracking if you're taking your meds properly, even going with patients to the hospital if things get
Yeah.
really bad. It shows a level of day-to-day hands-on support that's just incredible.
And school nurses, too, where schools have them. They're the first responders for kids.
Hugely important.
Mm-hmm.
Imagine being a child having an asthma attack at school, having a nurse there who knows what to do. That's massive reassurance for the child, the parents, the teachers.
Yeah, absolutely. Which actually leads perfectly into a part of the blog that, well, it really struck a chord with me personally.
Oh, yeah.
It's a personal story, mine actually, about having a silent asthma attack. I was being treated for a knee injury, completely unrelated,
Wow.
and suddenly I just couldn't breathe properly. But because of the pain, the situation, I couldn't even really tell anyone clearly what was happening. No dramatic wheezing, you know.
That's scary. A silent attack.
Oh.
They can be really dangerous because the warning signs aren't obvious.
Exactly. And it was a nurse who noticed. She was focused on my knee, but she saw something wasn't right. The blog mentions she saw the panic in my eyes, noticed my breathing was shallow, maybe heard a tiny wheeze.
So she was looking at the whole picture, not just the injury.
Yes. And she acted immediately. Got my inhaler, stayed with me, kept me calm. Honestly, I think she stopped it becoming a full-blown crisis.
That's a powerful story. It really shows how observant and, well, holistic nurses are. They're not just treating one symptom, they're caring for the whole person.
It completely changed how I see nursing. She wasn't just doing a job, she was present. She saw something I couldn't even express.
It really highlights their impact, doesn't it?
It does. So with International Nurses Day almost here, the blog wraps up with some nice practical ways we, as the Asthma Friend community, can show our appreciation.
Yeah, some good suggestions there. Simple things, really, like sending a message or a card to a nurse who helped you.
Or even just a public thank you online. Maybe use the hashtag International Nurse Day.
Right. Or if you're able, maybe it's a donation to a nursing association,
Yeah.
and just talking about it, educating other people about how crucial nurses are in asthma care. That's valuable too.
Spreading awareness.
Hmm.
So really, as we wrap up this deep dive, the main takeaway feels pretty clear. For so many of us living with asthma, well, behind every managed breath, there's often a nurse providing that vital care and support.
It's that presence the blog talks about, isn't it? And those really uncertain, maybe scary moments that asthma can bring. Just having their steady hands, their watchful eyes, their calm voice. It makes such a difference.
It really does bring peace of mind.
Yeah.
So maybe a final thought for everyone listening in our Asthma Friend community. Just take a moment to think about those times you felt vulnerable. And maybe reflect on the nurse or nurses who made a difference. Perhaps even find a way to let them know. Their work is truly incredible and often, like the blog says, unsung.